Hello, good day. I'd like to welcome you for the Lung Cancer Network podcast today. I'm Hilmi Lockman. I'll be representing Lung Cancer Network of Malaysia. So we have Indra here, which is my guest today. So we're going to be having a nice chat rather than a formal interview. I think it'll be much nicer for everybody. So I'll let Indra introduce herself and we can get cracking after that.
Hi, Dr. Hilmi. Thank you so much for having me on your podcast. Hello, everybody. My name is Indra Balaratnam, and I'm a consultant dietitian. I've been a dietitian here running my practice here in KL for over 28 years now. I honestly don't know where the time has flown, but I guess like what they say, you know, when you enjoy what you're doing, you don't really feel the time. But I run my own private practice, Indra Balaratnam Nutrition, and technically I see private clients one-on-one. Most of them are referred to me by doctors, or some of them are by family members who have come to see me before. And rather than being in a hospital setting, I actually make home visits to see my private clients. The reason why I like doing this, right, Dr. Hilmi, is that when I go to the house, I get to also speak to all the other family members. And as you know, they say it takes a village to run a family, right? Yeah. So where cancer is concerned, where you're helping a family member in dealing with cancer and helping them with their diet, it really helps when there's also family support. No one can do it on their own, so this is why I like taking that time in talking to families about that.
Okay, brilliant. Okay, fantastic introduction. So you know that Indra is a dietitian. So we do normally hear dietitian talking about their experiences and helping us to deal with cancer patients. So Indra, how did you get into being a dietitian? I'm quite sure a lot of people would like to find out.
Yeah, actually, come to think of it, right? When I never had anybody that I knew personally that was a dietitian. I never had a family member that was one. We had doctors in our family. I knew about that, but really no one that was a dietitian or a nutritionist. But at school, I was always very active. I liked health. I liked being healthy. I liked helping people as well. And so when it came to choosing a career or what to study before going to university, I found myself a thick book that had all the different types of careers in there, and I was flipping through it. And I came across dietetics, what a dietitian does. And it sounded very interesting. It was about food, but it was also medically inclined. It was about helping a person to eat healthy, to stay healthy, as well as to also eat in dealing with a specific health condition and how they could make themselves better by eating better. And it was also part of supporting the medical treatment that they were having. So the more I knew about it, the more I felt, hey, this is quite a profession that I might enjoy. So when I ended up in university, I went off to the US to study nutrition and dietetics. The more I got into the course, the more I actually enjoyed it. Then when I came back here to Malaysia to practice, I could really see that it was a bit of a missing gap. So yeah, that's the, in a nutshell, I guess that's how I ended up becoming a dietitian.
Great. Does that mean that each time when you have a get-together with your family and then everybody will see, I think we better not talk to Indra. She's going to be telling us not to eat this, not to eat that.
In the early days, people would inevitably, you know, I guess it's a topic that people like. So inevitably the conversation can get into, what do you think about this food? Is this food bad? But my personal philosophy about food, right, Dr. Hilmi, is that there's nothing bad about food. Never look at food in a negative way. Eating has an innate purpose. The reason why we eat is for our survival. Food is what nourishes us from every life stage, from the time we're born, or even as conception, right? From the start of conception, if you think about it, till the day we're born, till the day we become a kid, a child, an adolescent, a young adult. Food plays a role in every part of our life stage. So in preventing cancer at a time where you're still healthy, of course, eating well has its benefit there to help you prevent cancer or at least minimize your risk. But when you end up becoming diagnosed with cancer as well, and then you're living with cancer, that's another life stage. A little bit of a bend on the road, if you'd say. But that's a time where diet also helps you to replenish, to recover, and it also complements the treatment that your doctor might be giving you during this life stage. So yeah, diet does play a very key role in all that. So that's why my personal philosophy about food is never look at it negatively. There's a certain gratitude to being able to have access to food. So we should never ever look at it negatively. But what we should be looking at is how do we manage it? How do we enjoy a diet that we like, that we can also sustain? So that's honestly the role of the dietitian in helping people to see that, to appreciate the food that we get.
Okay, whenever we talk about cancer, we definitely talk about prevention. Okay, so what would be your advice for people who want to try to prevent getting cancer? What is the type of food that will be ideal or to avoid or to consume?
Okay. Now, when you're talking about eating well to prevent any types of disease, not just cancer, you need to get back to the basics. In this day and age where we're all so busy, you know, we tend to just eat things without having any, giving it any thought. We just scroll through, grab, you know, we see, oh, this sedap, this is on offer, this is promo, you know, all kinds of these things are coming to us, and we end up just eating. But if you're talking about eating well, then you need to be mindful of what you're eating. So when it comes to preventing illnesses, just get back to the basics. Try to eat your meals or your food as close to its natural whole form as possible. And try to have a variety of food. Variety meaning have choices from all the 5 major food groups, which is your grains, your proteins, your fruits and vegetables, as well as your milk and dairy. So the 5 major food groups. So have a wide variety. The more variety of different types of foods that you eat, the better chances of you getting all the key important nutrients that you need for your optimal health. And then the second part, of course, is also balance. You don't want to overeat a certain food group, nor do you want to deprive yourself of a certain food group. Because when you deprive yourself of a food group, then you also deprive yourself of important nutrients. And then thirdly, of course, is portion, the balance of the portion. And I've got a little trick for all of you all about how do you balance out your portion. Use your hand. Use your hand. So for example, if you're eating your grain foods, like your carbohydrate foods, use a fist size of it. So like for example, a fist size of rice. So this should be roughly a serving of rice. If it's your meats.
So like that's not just you holding the handle of the scoop.
No, but at least using, because the hand goes with us everywhere, right? So use your hand as a rough guide to a portion of food. So for example, if you're going for your nasi campur, or you're at a office party, where you know you've got all kinds of trays of food, and you're wondering like, oh no, how much should I put on the plate? Let your hand be your guide. So for your carbohydrate food, roughly about a fistful, a little bit more if you're feeling a little bit hungry, but generally it should be roughly about this size of your rice, for example, or your noodles. And then for your protein foods, for example, a piece of fish or a piece of chicken, use the palm of your hand. The palm of your hand. This would be a nice sufficient size. For vegetables, 2 handfuls of veggies. So you want to eat more vegetables, being that vegetables have a lot of protective nutrients in there. Plus they're low in calories, so they help to balance out the caloric volume of your meal. For fruit as well, a cupful, like a cupped hand. So for example, if you're eating grapes or you're eating strawberries, how many little pieces can you fit in a cupful? I know your next question is probably going to be about durian. So we all know durian's a fruit, and you're probably wondering what's a sensible serving of durian?
About that much.
A cup can, okay, for 1 serving.
Yes.
So don't worry, you always have another chance to have another serving of durian. And then of course for dairy, it would be like a glass of milk, a slice of cheese, a little small little cup of yogurt. That would be a sensible serving.
How about kuehs?
Things like dessert.
Dessert, yes.
Right. Don't worry, in a sensible diet, desserts do have a place in them for healthy eating. I would recommend that you use your credit card as a visual guide for your kueh.
I see.
So rather than having several pieces, just have one piece. That's roughly about the size of your credit card. So even if you're going to have a piece of cake, just use your credit card. That's a good, sensible size.
Okay, that's quite reasonable.
Yes.
Anyway,
so you don't need to cut off everything, but I think being mindful of portion is very important.
Okay. Now, if we talk about, again, now we're going to actual patients who unfortunately has been diagnosed, is going to undergo treatment and things like that. So, one of the signs that sometimes that we come across is that patients have lost weight, and they don't have the appetite to eat. And what could you do? I mean, from your end, trying to advise them, trying to build up their nutrition.
For newly diagnosed patients, especially as they're going to be going for treatment, it's really important for them to nourish themselves well prior to going for any type of treatment. So that's that window of opportunity to really nourish and fortify your body with good nutrients from your food. So that's why, but at that same time, when a patient is newly diagnosed, there's also a lot of anxiety, there's a lot of worry, and this can lead to feeling down, depressed. And as we all know, those types of feelings can affect their eating, their appetite. So needless to say, that's why sometimes that weight loss stems from those underlying issues. So with a lot of the clients that I work with at that stage when they're newly diagnosed, these are the things that I address with them. Asking them, are these things the possible causes for your weight loss? And almost always, a lot of times, it's that, as well as not eating proper meals. And at that point also, a lot of times they drastically change their diet. They might suddenly only want to eat all vegetables. They might only want to have juices. I've seen that in some patients. They just drastically change their diet. But that's not necessarily a good thing. So what I do with my clients at that stage is we sit down, we take a look at what they overall eat, and then we maintain a simple way of eating of the foods that are highly nutritious, but we cut out the foods that are low in nutrients. For example, a lot of the processed foods, a lot of those packaged foods that don't give you much of the nutrients. So we kind of go back to the basics, like what I talked about just now. And as well as coming up with a menu plan that the patient can follow, so that can help them to maintain their weight. And also to explain to them why it's important to maintain their weight before going into treatment. So I think when the patient is more aware of the whys, then they can understand why the hows work. So rather than worried family members nagging them to eat well when the patient isn't in that headspace, know. So sometimes there's a lot of extra nuance to a diet. It's not as simple as just the dietitian giving you a menu plan like that. Anyone can do that. Any patient can even Google a menu plan. For that matter, even ChatGPT or AI, you can get a menu plan just by asking ChatGPT to give you one. But I think when you see a dietitian, a really proper, good dietitian, and we are all trained for that, is to really see you as an individual and to work with you on a diet that is workable and sustainable for you at every life stage of your diagnosis with cancer.
So will you go and say, okay, what do you normally eat? What type of food do you normally like? And things like that? Or you say, okay, fine, you just, you need to take this.
Well, my job in my sessions with my clients is I actually facilitate them to work out a menu. So I always let them take charge. They are always in the driver's seat. I think there's nothing more scary than a person who has been newly diagnosed with a health problem to suddenly feel like they are no longer in control. And then when they are in that position, they lose faith in themselves, their own ability. And as we know, part and parcel of cancer treatment is that empowerment. So as a dietitian, my job is to empower them to be able to still think about what foods do you feel would nourish you. Of course, my role is there to also give them guidance. So based on my guidance, then we all sit down and work out what are foods that are suitable, what you might want to cut down on, you know, what you might want to focus more on. So that has always been my personal philosophy, and that's my approach to working with cancer patients.
Now, I know that we see more and more, I certainly see more and more that, people are consuming less greens and less fruits.
Yep, that is very true.
How are you going to encourage? I mean, I know that it's probably going to be catching up. I mean, because we see that a lot in children nowadays. But for adults suffering from cancer, unfortunately, you want to encourage them to take fruits because it will be good for them. They've got certain vitamins that wouldn't be available anywhere else. The same thing with the vegetables. So
how do you encourage something that might seem difficult, right?
Yes, almost impossible, I think.
Start
sometimes.
Small changes equals big wins. So even, for example, if a client who never used to eat vegetable before, now, for example, at lunch, just let them know, just at least one spoon, one scoop of a vegetable. Or even if you don't like vegetable, maybe some slices of cucumber or some slices of tomato. Something small like that. If they can already put that on the plate and eat that little bit, that's a win. That's a win. And almost always, right, Dr. Hilmi, most patients, when they say they don't like this, they don't like that, they actually do like it. Out of all the veggies and out of all the fruit, there must be at least 1 or 2 or 3 types that they might like.
They're not allergic to greens, right?
Correct. It's just that in their everyday eating, because they're not mindful of it, they don't even think about putting it on their plate, or they might order a dish where there's not much vegetables in there. But if you actually sat down and chatted with them and asked them, there must be some veggie you might like. And I had a patient that was exactly this case, and he told, when he actually thought about it, he said he liked corn, he liked carrots, and he also didn't mind French beans. So with that 3 variety, then the wife was able to at least cook something within there. Like, for example, she made egg omelette with some shredded carrots in there.
I see.
So she presented the vegetable, but with some egg in, made it into an omelette. So that was his way of also getting that carrot, that vegetable serving in there. She would make French beans. So every meal she would have some kind of vegetable that he liked. So very slowly I taught her how to mix the vegetable with something else. So for example, the French beans was then also cooked with some tofu and some mushrooms. So this is how you kind of sort of very subtly add other things to a variety that they like. And before you know it, it becomes exponential. You know, you like this, now the variety gets bigger. So like I said, there's always a solution. It's just sometimes we just never think about it.
You know, when we're talking about, I mean, there's vegetables. Now, when we're talking about protein sources, so we're talking about meat generally. So we've got white meat, we've got red meat. White meat is quite easy. So you don't have to cook too long, and you can retain the nutrition. But sometimes you talk about red meat, it can be tough. So will you advise that, how about people say, I've got to cook an hour, 2-3 hours, just to put it on the stove, just so that it can be edible?
Depending, like Malay style, I guess you're referring to, like when they make a rendang, for example, where the meat is cut into cubes and it has to be cooked. Well, one way to shorten cooking time, of course, is to cut the meat smaller rather than in big chunks. To hasten the cooking as well, you can use a pressure cooker because that helps to soften the meat so that you can cook it faster. So having some gadgets, some kitchen gadgets, especially if as a family you want to cook more at home rather than going out to eat so much, some of these little gadgets can be very
How about a
handy.
microwave?
Microwave is not bad as well, especially for heating up foods, thawing, defrosting. But honestly, you don't need to have too many gadgets. Just pick, 1 or 2 that you might need, and you can learn different types of recipes from that as well. But all cooking methods that can help to make the chore easier is definitely a welcome gadget to have.
Okay. How about air fryers? Do you use any?
Yes, I have an air fryer at home. An air fryer can actually be good, especially if you need to cut down on eating fatty foods. Maybe you're also concerned about your weight, yet at the same time you need to eat healthy. An air fryer can help you to enjoy foods that you would have typically deep fried with a lot of oil, where it would fat content would have been high, calories would have been high. But by putting it into the air fryer, you still get to enjoy it as part of your variety, but without having to use so much oil. So yeah, it's not too bad. And a lot of these gadgets are now quite inexpensive. So you can get different brands in a price range that is workable for you.
Okay, let's say that a patient's undergoing treatment and unfortunately if they have to take chemo, they're going to be no appetite, nauseous and things like that. And plus, some of them will probably be losing significant amount of weight.
Yes, of
so
course.
what could you do for this people, just maybe to encourage them to eat, increase appetite, things like
that? And that's a challenging phase for everyone, because everybody has different side effects to the treatment. Everyone has different types of things. So yeah, a lot of us as dietitians work with them on that. For example, swallowing, if a patient has swallowing difficulties, sometimes a speech therapist might be brought in to help assess their ability to chew. Depending on certain foods that they might not be able to tolerate, then we might look at alternatives, other things. Of course, there are also supplemental foods that you can get from the pharmacy. A lot of them are beverages. If you were to go to the pharmacy, you'll find them as beverages. But they technically work like liquid food. So they're fortified with vitamins, minerals, and they've got all the nutrients, carbohydrates, proteins, the healthy fats that are in there. So they can be used to help complement or supplement or fill in the gaps. You know, like if a patient can't eat a lot in terms of a volume, by having this beverage, that they can help to boost up their calorie intake as well as their nutrient intake. And it's consumed in an easy way. They can just drink it, and, you know, so that they can get all the nutrients that they want in a simple way. Because sometimes when they're dealing with such advanced side effects, eating a meal can be tiring. So at this stage as well, being that volume, you might not be able to eat much volume. This is the time you need to focus on the nutritional quality. So foods need to be fortified. And with a lot of my patients, I actually teach them how to fortify their foods. So you don't necessarily have to buy expensive supplements like that, but even using things like milk powder to add more protein to your food, to your beverages, adding some minced meat, adding eggs to add on more protein to your foods. Those are some of the ingredients that you can use.
Wonderful. So there seems to be quite a lot of options there.
A lot of options, actually, and that's why I would tell families of cancer patients not to hesitate to ask your doctors to refer you to see a dietitian, because this is our area of expertise. We are specifically trained to help patients and families to understand foods and to find solutions to all the challenges that they have in order to meet their dietary goals. So yeah, do ask your doctor to refer you to a dietitian.
Okay, I think we've had a very brilliant session. Okay, brilliant explanation from Indra, telling us about how do we approach and what are the tricks that we can try and do and try to enhance eating ability, or I think whatever requirements that the patient needs. But again, getting a dietitian to give the right advice will be extremely valuable for our cancer patients and also to their family members as well.
Right, exactly. So that at least the dietitian can help to debunk some myths, help the family to create solutions, and helps to allay fears of the patient themselves.
Right. So I think we can call it a day for this podcast. I mean, I'd like to give extreme thanks to Indra for giving her time for our session today.
Thank you to everybody as well for joining us. Thank you so much. Thank you.
Thank you for all the everybody who's tuned in to LCNM podcast tonight, or today, really. So we will stop here and we'll go for the next session next. And I hope you can join us next time.